In the spirit of reconciliation, we acknowledge that we live, work, and play on the traditional territories of the Blackfoot Confederacy, Siksika, Kainai, Piikani, the Tsuut'ina, the Stoney Nakoda Nations, the Métis Nation, Region 3, and all people who make their homes in the Treaty 7 region of southern Alberta. I am grateful for the traditional knowledge keepers and elders who are still with us today, and those who have gone before us. I make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on. Thank you for being here today.
Hello and welcome to our presentation. My name is Cody. I am one of the peer researchers involved in CARMHA project. CARMHA stands for Cannabis Relief in Mental Health and Addiction. This is an 18-month research project funded by the Mental Health Commission of Canada. Our aim as a peer-led research project is to better understand the impact of cannabis use on mental health within in-risk populations. In other words, people using substances and who are without shelter. This is a collaborative project between AAWEAR and Habitus Collective. In our time with you today, we will 1. Give a brief introduction to the organizations involved in this work. 2. Introduce the research objectives of the CARMHA project. 3. Talk about the objectives, goals, and outcomes for this work. 4. Share where we're at in the project lifecycle. 5. And finally, share some observations from the research so far.
A little bit about AAWEAR, Alberta Alliance Who Educates and Advocates Responsibly. We are a provincial incorporated nonprofit society that focuses on peer work across Alberta. The majority of our membership are folks who come from lived or living experience of substance use, and we strive to educate communities on safer use practices. We currently have chapters in Edmonton, Red Deer, Calgary, and Lethbridge, and are starting to focus on developing a new chapter in Grand Prairie. In each of our chapters, we conduct peer outreach, peer navigation services, advocacy, and community engagement projects and peer research initiatives such as this. A lot of our programming is through collaboration with other organizations, medical professionals, and researchers. So it's really exciting that we were able to take part as a key partner in the CARMHA project.
Habitus is a research and evaluation consulting company and a longtime supporter of the work of AAWEAR in Alberta. We work in the nonprofit sector, primarily supporting research and program development from an equity standpoint. We often find ourselves building collaborative projects, helping bridge community and academic institutions. As an example of this, the CARMHA project has also built a partnership with the University of Calgary, Faculty of Medicine's Dr. Rita Henderson. This partnership enables us to integrate into academic processes, such as an ethics approval process and academic avenues for publication. But it also allows us to tap into critical experiences and insights from Dr. Henderson and her research team.
To introduce you to the CARMHA project, we're looking at the impact of cannabis on mental health of in-risk populations. We're conducting this research through community-based participatory research practices and taking on a peer-led approach. 3 research objectives for this project include raising awareness and share learnings to inform and shape future policy, practice, and informed usage of cannabis. Secondly, we're looking to reduce the stigma around cannabis use and mental health by developing evidence-based policy suggestions. And then lastly, we're looking to utilize the lived experience of peer researchers and build their skills and capacities. The CARMHA project was developed with the intonation of being strongly grounded in community-based participatory principles. What this means is that the insights and perspectives of people with lived experience of substance use and homelessness are integrated throughout the research project. In this case, peers from AAWEAR have been critical to guide the development of research tools, they led the data collection process, and shortly they will be co-developing the analysis of the findings. Overall, we hope that by doing this research, we will be able to offer new insights that will shape policies and practices around cannabis use and mental health. We think that taking a community-based approach and having peer researchers integrated in the research project helps us achieve our second objective, which is to reduce the stigma around cannabis use and mental health. Also, and the peers here today can speak to this, Integrating peers into the research project has been an effective way of filling out skills and capabilities they are already building through their other professional roles as peers at AAWEAR. So just briefly, the goals of the project are to understand the factors shaping cannabis use among high-risk populations, as well to understand the impact of cannabis use on the mental health for high-risk populations, and then identify the barriers and supports available to those seeking services, and then understanding the impact of stigma and legalization on these populations. And the outcomes we envision are not only traditional academic outputs like publications, but also community resources to support organizations and peer-led organizations better understand the mental health impacts of cannabis use and other intersecting factors like substance use and homelessness. We also see great promise in the idea of creating a blueprint for ethical peer-based research and in having a training cohort of peer researchers taking leadership in future research projects. Looking at our project phases, we broke this project down into 5 groups. Phase 1 was the preparation of ethics, development of tools, peer training, and background reviews. Phase 2 consists of data collection, surveys from both Calgary and Edmonton, interviews, and journey mapping. Phase 3 is a mixed method of co-analysis for the findings. Phase 4 will be conducting reporting and dissemination, which includes our digital community of practice. And Phase 5, we will be wrapping up the project with our evaluation. At this moment, we are currently in Phase 2 of the project, wrapping up our quantitative data collection and moving into qualitative interviews and focus groups. We are doing a rolling analysis with our data, and Phase 3 we will be starting shortly, in which we will co-analyze the quantitative data, approximately 200 surveys, with the team. Because we have yet to enter into our more formal data co-analysis process, we are focusing today on what we are learning about peer research so far. As you can see, we have an evaluative component to this project, and it asks us to reflect on what we have learned so far, not only to assess if we have achieved our objectives, but also to learn in real time what we could do better. One of the first things we explored was, how has peer research worked? What are our strengths, and what lessons can we apply? Lauren and Cody, 2 of the peer researchers for this project, will speak next regarding 3 main takeaways about peer research, including a discussion about the data collection process, the model of research, and the creation of the research.
Going into this peer research, I knew it would be empowering to our community and it had the ability to bring about social change. After going out into the field to conduct the surveys, I also felt like it gave me a sense of inclusion, purpose, confidence, and connection to my peers. Our shared lived experience as people who use drugs set the stage for honest responses and open dialogue. The stigma and discrimination with high-risk folks is all too real, so it was nice to advocate and give peers a platform to voice their perspective. This data collection has identified needs and challenges for our peers and gave me insight on barriers surrounding cannabis use for mental health. An example being that some participants felt that they could benefit from cannabis as a harm reduction tool for their mental health struggles, but they did not have the capacity or the money to obtain a prescription for medical marijuana.
My street knowledge, my street smarts, and my ability to connect with others as I've been in their same shoes. My ability to pinpoint who is who might participate, and who wouldn't. I sat back and watched people, as I am an observer. If I am sitting there for 5 minutes and notice someone using, then we know to approach. Walking up to them because I am dressed the way I am. I look like I lived in the community, and the only thing that made me stand out was the badge and the clipboard. I would start by asking how their day was, work my way into finding out where they're at in the moment, then find out if they qualify, and build a relationship with them prior to asking them if they want to participate in the survey. Would always pitch the gift cards last, framing it from the perspective of helping the change of policy. Lots of people we spoke to were really interested in helping change policies.
As a peer outreach worker, I found surveying led to a deeper discussion for the participant, like learning about their needs and providing them with harm reduction tools, housing, safe using supplies, ID, and offering invitations to join our community chapter meetings. Participants felt safe to open up about their struggles and unmet needs, and many would debrief with us at the end of the survey. We set folks up with their peer navigators to support and guide them through those barriers. Spending that time with peers gave me the opportunity to self-disclose and have a deeper understanding of who they are as a person and how cannabis has affected their lives positively or negatively.
The purpose of the survey was not just to research, but to build relationships with those on the street. People will notice me at the LRT station and say, "Hey, didn't you do that survey with me?" So it is helping to build those connections. It also breaking down barriers for peer to find out what they need and take discussions deeper. I have been able to mentor my colleagues on how to connect with others through this survey and who to approach.
The many hours of training was great because I felt ready and prepared to conduct research ethically and confident about my ability to take participants through the informed consent and confidentiality process. At AAWEAR, we believe nothing about us without us. So to be included in developing and analyzing this research, it only made sense to have our lived experience influence the questions we were asking peers. Effective communication is key in obtaining honest and cooperative responses. It really does take one to know one, and the questions need to be laid out in a way that shows we can be trusted.
It's about the whole purpose of the survey itself, changing policies and helping the organization. It is more than just a job. I've always been on the other side of the survey. I always did it for the gift card, so I wanted to sell this from a different perspective.
As always, we're happy to take questions and feel free to contact us anytime. For more details on our project, please visit the CARMHA website where you can learn more about the peers involved. It is also updated regularly with materials from the research project. Thank you for your time.